and new at 10, as many people are returning from or heading out for holiday travel, we're seeing a spike in Omicron cases in Arkansas, which is causing concern for state health officials. 5 News reporter Micah Wilson joins us live in Fayetteville with what Arkansans should know as they travel. Micah?
Hey, Erica, the Arkansas State Department of Health is anticipating large COVID surge, and so is asking people to do 3 things: get their COVID-19 shot, get their booster dose, and get tested.
In the middle of what we're calling an Omicron variant surge.
The Arkansas Department of Health is confirming 63 cases of the Omicron variant in our state, less than 2 weeks ago after the first reported case entered Arkansas on December 17th.
I think many of us are hoping is that Omicron is going to be at least a bit less severe than Delta, which may mean that we'll have less people in the hospital.
But right now, that remains unknown. Dr. Ben D. Miranda with Crossroads Telemedicine works with Natural State Labs, which has a mobile COVID testing site set up at the Northwest Arkansas Mall. He says Omicron cases are doubling every 2 days. That's worrying state health officials too, because they don't have the proper treatment for Omicron like they do for the Delta variant.
A lot more transmissible than basically every other variant we've seen to date.
According to data from the Northwest Arkansas Council, hospitalizations in NWA are up slightly. In Benton and Washington counties alone, 132 new cases of COVID were reported on Monday, with 72 COVID patients currently hospitalized.
Please get vaccinated. Get your booster. Only about 15% of Arkansans that are eligible have gotten the booster dose.
Health officials are also calling for holiday travelers to get tested before heading back to work, something Dr. Ahmad Brown with Natural State Labs says Arkansans are already doing.
You know, actually, we're seeing a surge already. That started probably a couple weeks ago, and we are seeing it ramp up exponentially right now at our drive-through locations.
The testing line outside the Northwest Arkansas Mall usually closes at 3:30, but Monday night, cars were still in line to get tested at 5 p.m. That's why doctors urge you to plan ahead, saying you should also allow yourself time to wait before testing.
Ideally, 5 to 7 days is after a known exposure or after traveling is the most appropriate time to get tested.
And for the most accurate results, doctors tell me you should not get tested before 3 days because you should not get tested before 3 days for accurate test results. Live in Fayetteville, covering news where you live. Mike Wilson, 5 News.
All right, Micah, thanks. Some other COVID-19 testing sites in Northwest Arkansas include Washington Regional in Fayetteville, along with MedExpress and Natural State Labs, which both have sites at various locations across Northwest Arkansas. And in the River Valley, Baptist Health Urgent Care Fort Smith and Ben Guerin Park offer testing. And of course, you can go to your county health department. Some places may require you to schedule an appointment.